To our channel. Today we are going to give you a crash course in rickets. We are going to be going over the origin of the name, the date of discovery and who discovered it, cause and mechanism of affliction, risks and environmental factors, diagnosis criteria, body systems and populations affected, dietary restrictions of the disease, available tests and treatments, average cost of treatment, risks of treatments, and preventative strategies. So let's get started.
Rickets was discovered by Francis Gilson during an outbreak in the 17th century in England. At the time, it was also called the English disease, although there are recent discoveries of skeletons showing signs of rickets dating back 2,000 years ago in Rome. The origin of the name Rickets is Greek, meaning spine.
Causes and mechanism of affliction. Your body needs vitamin D to absorb calcium and phosphorus from food. Rickets can occur if your child's body doesn't get enough vitamin D or if his or her body has problems absorbing vitamin D properly. Occasionally, not getting enough calcium or lack of calcium in vitamin D can cause rickets. Lack of vitamin D. Children who do not get enough vitamin D from sunlight and food can develop a deficiency. Your skin produces vitamin D when it is exposed to sunlight, but children in developed countries tend to spend less time outdoors. They're also more likely to use sunscreen, which blocks the rays that trigger the skin's production of vitamin D. Vitamin D can be found in foods such as fish oils, fatty fish, and egg yolks. And vitamin D has been added to some foods such as milk, cereal, and some fruit juices. Malabsorption. Some children are born with or develop medical conditions that affect the way their bodies absorb vitamin D. Some examples include celiac disease, inflammatory bowel disease, cystic fibrosis, and kidney problems.
Risks and environmental factors. Here are some examples of different factors that can lead to rickets. Sometimes kidney problems can cause rickets by affecting how the body absorbs and uses vitamin D, calcium, and phosphate. Dark skin. Dark skin doesn't react as strongly to sunshine as does lighter skin, so it produces less vitamin D. Mother's vitamin D deficiency during pregnancy. A baby born to a mother with severe vitamin D deficiency can be born with signs of rickets or develop them within a few months after birth. Northern latitudes. Children who live in geographical locations where there is less sunshine are at higher risk of rickets. Premature birth. Babies born before their due dates are more likely to develop rickets. Medications. Certain types of anti-seizure medications and antiretroviral medications used to treat HIV infections appear to interfere with the body's ability to use vitamin D. Exclusive breastfeeding. Breast milk doesn't contain enough vitamin D to prevent rickets. Babies who are exclusively breastfed should receive vitamin D drops. One form of rickets can be inherited. This means that the disorder is passed down through your genes. The type of rickets, called hereditary rickets, prevents your kidneys from absorbing phosphate.
Symptoms of rickets can include delayed growth, pain in the spine, pelvis, and legs, muscle weakness, bone fractures from falls and traumas. Late tooth eruption, problem with tooth enamel. You should go see a doctor if your child develops bone pain, muscle weakness, or any obvious deformities.
Body systems affected. Rickets affects the bones of our skeletal system. The bones become weak due to lack of vitamin D and calcium needed for strong, healthy bones. This causes the bones of the body to grow improperly and become misshapen. Populations most affected. Rickets only affects growing bones, so it mostly occurs in infants and children, but can sometimes be seen into teenage years. This vitamin D deficiency affects males and females in equal numbers. Babies of nursing mothers whose diet is deficient in vitamin D can be affected with this disorder. Although rickets is rare in the United States, children who are dark-skinned and living in cloudy northern cities, as well as children on restricted diets due to cultural or religious beliefs, are more likely to develop this disorder. Rickets is more common in regions of Asia where there is a lack of daylight and/or intake of meat due to a vegetarian diet. Northern Yemen and Kuwait are also areas where vitamin D deficiency are prevalent due to lack of exposure to the sun because of cultural practices. Dietary restrictions of disease. Individuals must consume food sources that have vitamin D.
There are treatments and tests available for this disease. Available tests include blood tests to measure the levels of calcium and phosphate in the blood, bone x-rays to check for bone deformities, and in rare cases, a bone biopsy will be performed. Biopsies involve the removal of a very small section of bone, which will be sent to a laboratory for analysis. Available treatments can include replacing the missing vitamins or minerals in the body by encouraging growing kids to consume food products high in vitamin D, such as fish, liver, milk, and eggs. Increase their exposure to sunlight. Taking calcium and vitamin D supplements. If skeletal deformities are present, your child may need braces to position their bones correctly as they grow. In severe cases, your child may need corrective surgery. For hereditary rickets, a combination of phosphate supplements and high levels of a special form of vitamin D are required to treat the disease. The average cost of treatment depends on the hospitalization costs. The risk of treatment can include overdose with calcium, phosphate, and vitamin D, the risks that come with corrective surgery, and infection at the surgical site.
Although rickets is usually caused by low vitamin D, most children with low vitamin D do not get rickets. Rickets is more likely found in babies and children who have low dairy intake or babies who have been breastfed for a long time. To prevent rickets, be mindful of your dairy intake, introduce solid foods at 4 to 6 months of age, identify signs of low vitamin D and treat it, exposure to sunlight and avoid direct sunlight, and managing vitamin D intake. To make sure your child eats food that contains vitamin D naturally, such as fatty fish, fish oil, and egg yolks, or foods that have been fortified with vitamin D, such as infant formula, cereal, bread, milk, and orange juice.
This is an article from December 2018, and this is an example of a recent case of rickets found in Australia. The parents of 3 children pleaded guilty when they were put on trial for causing a serious disease to their infant. It was caused by the parents' lifestyle of a vegan diet they were pushing onto their children. This is to show the rickets is still around, even in developed countries.